It's really great to be here. Before I go into today's presentation about COVID and government interventions, I hope you'd allow me the pleasure to introduce myself a little bit. I would love to tell you who I am, where I come from, and what drives me. I'm a second generation American Austin. My family comes from the Caribbean and from Great Britain, and I was born in New York City. And in fact, I grew up on welfare, living below the poverty line, me and my mother. My mom, of course, taught me to study hard. Of course, that's any job for a child, is to study hard. And despite my studies, I got into gifted programs, and I thought I was doing very well. But according to my mother, it was really hard living in New York City with their burdensome rules and high tax rates. My family couldn't keep up with the high and complicated taxes. They weren't encouraged to save. And the high school that I was slated to go to was busted for drugs at least 4 times, on average, 4 times a year, with a constant police and gang presence. Through divine providence, my family was given a very generous offer to come to Kansas. And my mother jumped at the opportunity. She told me she saved all that she could and that she had sold everything that we owned so that we could afford moving down here. Which makes sense, because I always wondered when I was a little kid how we were able to get everything to fit into our minivan. Now I know. It was those 3 things, right? It was sacrificing, saving, and a little bit of luck, charity, right? That saved my life today. And I want to thank Kansans for that opportunity. So much so, I want others to have the same opportunity. I want the Kansas government to do for Kansans what Kansans have done for my family. All right? So you may not know my name, but I bet you know my work. Every year, for example, Governor Kelly vetoes giving you all 100% of President Trump's 2017 tax cuts. They call it the windfall. She vetoes that every year so that she can keep it in the piggy bank. Well, I authored the report that calculated those tax savings to you. So I guess you really liked the report.
Yeah.
The legislature is trying to get property tax reform kicked off, trying to make sure that county commissioners don't just raise the value of your home without lowering the mill rate. I kicked off that campaign last year with an op-ed asking for honesty when it comes to our property taxes. And then there is also what actually happened recently, the mask mandate chart, where Governor Kelly tried to mislead Kansans by showing a mandate chart that said mask mandates were more effective. And we realized that she was deceiving us and she had manipulated the data. We'll talk about that a little bit more deeply today. But if you haven't guessed, I support a radical fiscal policy, what I like to call keeping more of what you earn. And if I could add a little bit more to that, it would be to give freely to those who can't. So, I am humbled to be with you today, and let's have a good conversation. If you can, try to save your questions to the end. There's a good chance I might answer it, unless you are just begging to get your question answered, then just jump up and I'll call on you.
Okay.
If there's one thing I want to take from my presentation today, it's this from famed economist Thomas Sowell. He says, trade-offs have been with us ever since the late unpleasantness in the Garden of Eden. Right? Whether you are a passionate grassroots activist, or you work for the city council, or county commissioner, or a state legislator, state senator, or even the governor, you have to understand everything has a trade-off. Every decision you make has a trade-off, right? Even me coming here today, I could have easily been sitting at home watching Chiefs commentary while drinking a beer, but I decided to come be with you fine people today, right? That's the cost I pay. Go Chiefs. Right? But as trivial as that may be for my personal stance, for my personal standing, as a governor or as a legislator making decisions that affect the entire state of Kansas, those trade-offs may not be so comical. They can actually be quite disastrous. So our conversation today, we'll talk about the economics of COVID. I teach at Washburn University, I'm a lecturer there, so I apologize in advance, but I gotta do some lecturing. So we'll talk a little bit about econ, about COVID. But then we'll get into the government response. Then we'll talk about what I call trust the science. And finally, we'll talk about solutions. So, the economics of COVID. As people have said, this is a once-in-a-lifetime pandemic. What's so interesting about it is, just like any, or not just like any, but what's unique about it is that it's created shocks in both the supply and demand side. Supply side, of course, meaning people can't produce as much as they used to, things are more costly. On the demand side, people's consumer habits have changed. Remember when we couldn't find toilet paper at Sam's Club? At the same time, you also have more tragic consequences where people are getting sick, where people are dying, and that obviously has an effect on the economy. And so when we try to think about fighting COVID, the question that came up was, is fighting COVID an economic policy or is it a public health policy? Well, to better understand that, the whole purpose, of course, in fighting COVID is to reduce its transmission. So let's look at the factors that contribute to that transmission. Biological components of the virus, easy, public health, you need a doctor, right? A doctor, scientists, research to understand what makes COVID tick and how, of course, it spreads. That is particularly a public health issue. But government actions is an economic one. Remember, we're talking about trade-offs, and government can only function when it has the resources from the private sector, which means it's always a zero-sum game at best. And then finally, human behavior. Just like we all make decisions and give up something in order to do something else, that also has an effect on COVID. And so when we're talking about fighting COVID, fighting this epidemic, we have to consider the role of government and the value of the trade-off. Okay, so when we come up to government responses, I made two groups. Here's one. A government in fighting COVID can put out lockdowns, can do school closures, can do stay-at-home orders, can do outpatient clinic closures. In fact, I think Kansas did all four of these, right? You also could do these things. Mask promotion, ad campaigns, increase hand sanitizer production. We could relax rules so that work and consumer activity can be more flexible, more adaptable, right? There's a reason why I put these into two separate groups. One of them has a high economic trade-off. The other one is low. They both fight COVID, but to do so, one has horrible side effects, right? And the other has side effects, but it's not as bad. Guess what government did?
Bad one.
I don't know if you know this happened. Back in May, I can't get the number right, so I'm just going to say a few hundred doctors sent a letter to President Trump. This was in the midst of all these states implementing lockdowns to fight COVID. And they had expressed serious concern about the adverse health consequences coming from all these states doing lockdowns. Had anyone heard of this? Oh, good, because I hadn't before I researched it. I didn't know this was out there. And in that letter, they said, suicide hotline calls are spiking 600%. They said people are missing their cancer screenings. They said liquor sales are up 300 to 600%. Cigarette sales have gone higher. Family relationships have become frayed. Child checkups have been missed. For some reason, I can point you to many reasons why we collectively, and as well as government, put blinders on to those high economic costs. While there were a few out there, as I said, a few hundred doctors that had made known that there are health consequences to these lockdowns, right? By and large, the media and most government agencies weren't listening to it. And in Kansas, we had our own consequences. I'm sorry, did you want to take a picture? Go ahead and take your picture, please. You're welcome. In Kansas, we had our own trade-offs. What you're looking at behind me, you don't need to know the specifics. These are just business activities. In fact, these are business openings. The higher the number, the more businesses that are open. The lower the number, the more businesses that are closed. You can see that when Governor Kelly instituted her lockdown, or actually it started when she closed schools. Now, if you think about the trade-off of that one, that meant thousands of parents across the state now had to choose between going to work and staying home to supervise their children.
Yeah.
Right? And no brainer, parents chose to stay home. Right?
Yeah.
And so what you actually have is before the lockdown even started, business activity started dropping. And I think it bottomed out, looks like around mid-April, as low as 70%. So roughly 70% of Kansas small businesses were closed in the middle of Governor Kelly's lockdown.
Wow, that's right.
After the lockdown was over, business activity started creeping back up. But then we had the governor's reopening plan. And if you don't remember, I'll do a quick synopsis for you. Phase 1, reopening. Phase 1.5, reopening. Phase 2, reopening. Wait, I don't like phase 2. Let's go back. Phase 1.75, reopening. Okay, fine, we'll go back to phase 2, reopening. You know what? Forget it, it's really confusing. I'm just gonna cancel this whole thing. Right? Such a confusing reopening plan that unfortunately didn't really help business activity, and it turned sour again. Here's another, there's another trade-off, inequality. Now, progressives really like talking about inequality because they really feel it's a problem when some person is gaining prosperity faster than the other, even if we are all in a rising tide, seeing an improvement in life. The red line are high-wage jobs, and the blue line are low-wage jobs. What do you notice there? During the lockdown, who was most affected? Low-wage jobs. People that had to work in a grocery store, or had to work at a Starbucks, or had to work at a construction site, that had to physically be present in order to get their job done, they were the most hurt by the lockdown. Those high-wage jobs are inherently more flexible. So they saw a decline as well, but you can also see they bounced back relatively quickly, whereas low-wage jobs did not. And so what you actually have are lockdowns worsening inequality, worsening the standard that progressives like to hold themselves dear as fighting hard against. Okay, here's a good activity. So what you see here is a heat map of the United States. What we're gonna do, we're gonna go through the months of the year of 2020, and you're gonna see on this map some parts of the United States will turn more red than others. When that happens, that means that particular area is seeing more COVID cases. And of course, the areas that are not as red have fewer COVID cases. What I would love for you to do is pick out an area on the country, an area that you know either had a mask mandate, or had a lockdown, or had a school closure. And as we go through this, I want to know, can you tell whether that policy made a difference? And I guess everyone's going to look at California. Or New York, right? Okay.
New York.
All right, so here's March up here. We'll go through. Here's May. You can see it's kind of, COVID is pretty high in the coastal areas, but largely out of the country. Sparsely populated out here are meatpacking plants. And does Leavenworth have a meatpacking plant?
What?
No? Okay. Gotcha, that's in top.
Oregon.
No, we don't. I didn't think so. I wasn't sure.
We used to have.
Gotcha. All right, well, touchy subject, I can tell. Just gonna move on. So here's May. We're gonna keep going. Here's July. COVID completely inundates the South, from California all the way to Florida. And this was around the time Governor DeSantis of Florida was seeing a lot of pressure to institute more strict lockdowns. And around this time, Kansas had a mask mandate. But you can see how Kansas is performing relative to the rest of the country. We had very few cases compared to the rest of the country, and yet we had to have a mask mandate. Here's September. What did you notice? It's shifting, right? It left the South and now is moving to the Midwest, concentrating around the Dakotas. Here's November, coming into the cold months, right? So obviously it's high everywhere, but where is it still concentrated? It's still concentrated in the Dakotas. Here's January. Now what have you noticed? it moved back to the coast, right? It moved back south, it moved back east, it moved back west. Let's go all the way to the beginning. I'm just gonna play it all again.
Yeah.
What did you notice? COVID followed what I would call a seasonal trend. What does that mean? Contiguous states, that means states that shared a border, saw COVID cases rise at the same time, peak at the same time, fall at the same time. And COVID hit those regions with states that had a myriad of different policy interventions. Some of those states had a mask mandate, some did not. Some had a lockdown, some did not. Some had school closures, some did not. Those interventions, though, didn't pass the eye test. Could any of you pick out an outlier when COVID moved through the area? What it means is that nature is more powerful than mandates. So let's keep going, trust the science. So our sister organization, known as the Sentinel, it's a media journalism outfit that tries to hold other journalists accountable. We had noticed that Kansas was over-reporting its COVID cases. Have you guys heard of the PCR test?
Yeah.
Did you guys say no? Like,
We read the Sentinel.
oh, good, good. Well, I'll just explain for those who
Smarter than
don't.
the average person.
They found that the PCR test, the COVID test, was too sensitive. A PCR test works fundamentally like a smoke detector, right? A smoke detector picks up smoke particles, and if it gets enough smoke particles, it alarms that there's a fire, right? But we all know smoke detectors can go off just because of your bad cooking.
That's right.
Right? Smoke detectors can go off just because you have too many candles. So just like how a smoke detector can give you a false fire alarm, a PCR test, if it's calibrated too sensitive, can give you a false positive. And so we had noticed that Kansas has calibrated their state lab COVID tests were more sensitive than even the FDA's recommendation. So we had asked for, in this article, to lower those thresholds, because this affects, it's not, a PCR test would announce a positive case, and then Governor Kelly would come on saying how we have far too many cases, I think we need to do X policy, or I think we need to do Y policy. And obviously those can have disastrous consequences. So what we easily wanted, and I lost my train of thought here, was to lower that sensitivity so that maybe we can get nursing staff back to hospitals quicker, right? We wouldn't have to put them in a 2-week quarantine, right, dealing with a hospital surge if we realized they weren't infectious. They may have had COVID, but they're not infectious, not transmissible. We could have gotten them back to work. So we understood that there were positive trade-offs that could happen if we lowered that sensitivity. And just recently, we found out that Governor Kelly took our advice, took our research, and lowered the sensitivity for state-conducted COVID tests. Still too high, but moved it in the right direction. And funny enough, I don't think I brought in this presentation, but you can even see if you watch the COVID case chart that the date that they changed the COVID test sensitivity, the drop became much sharper. What a coincidence. Okay, here's another one. Remember these two charts?
Oh, yeah.
Okay, so back in August, Secretary Norman had a press conference where he brought the chart on the left here, saying how mandate counties, a month after Governor Kelly passed her mask mandate, had fewer COVID cases than counties that did not. And no one questioned him on this, and the media wrote a story, and that was almost the end of it. And then I saw it. And I have research in looking at charts. I do them all day. I can do them with my eyes closed by now. And I had noticed something was very weird. You can tell here that there are two different axes, right? One for the red line, one for the blue line, but they both don't start at 0, right? And that can bring a little bit of an alarm bell. So what I decided to do, I just replicated the data, and all I said was, instead of 2 axes, we'll put it on 1, and then on that 1 axis, we'll just start it at 0. And that's what you get on the chart on the right.
Yeah.
So Secretary Norman really liked this dip here, and he thought that this dip meant something. This is the same dip over here if you put it to one axis. Now, if Secretary Norman wanted to say, because of this dip here, mandate counties are working, that is completely fine. I can't prove that dip wasn't the result of mandate counties, but it wasn't what he said. He had tried to deceive the public, saying that red line had fewer cases, it was lower than the blue line, when simply it wasn't true. So we wrote about it, we got picked up by the Washington Examiner, we got picked up by the Wall Street Journal, we got picked up by multiple local broadcast stations, and then finally the Wichita Eagle and the Kansas City Star had to mention us. A lot of work, but it was worth it. Okay? So after that, there was really a strong push to prove mandates were working. And let me take a pause here. I want to make sure it's perfectly clear. I do not have a problem with masks. I don't. I think they're a low cost, low economic trade-off option that can be done. But I also think good ideas don't require force.
That's right.
Right? So my issue is not with masks, it's the mandate in and of itself. So after that whole national escapade, Governor Kelly went to KU professors and she asked them to conduct a study to prove that mandates were effective. However, this KU study ignored national and statewide polls that said people were already wearing masks before the mandate even came down. This KU study said, no, that didn't happen at all. No one was wearing masks until Governor Kelly said so. In this report, here's a quote. They said, results are not increasing over time for Johnson County. And then as soon as they published that, cases in Johnson County rose 350%. So then that didn't work, so then they got the CDC involved. And they got some doctors and Kansas-related health professionals to conduct a study to prove that mask mandates work. However, this study missed the fact that mandate counties are far more likely to be in an urban county than a rural one. Think about it. Where are all your mandate counties? Wyandotte, Johnson County, Sedgwick County most of the time. Who else am I? Topeka, Riley, Douglas. They're all major population centers, whereas all your no mandate counties are concentrated usually out west or maybe in the southeast. So what I decided to do was take their study and try to correct for that urban-rural bias. Under the CDC study there, you can see that they picked 24 mandate counties, 81 no mandate counties. The average population in the mandate counties was 77,500, but the average population in the no mandate counties was a little over 12,000. That's a difference of 65,000 people, or 535%. What I did was much simpler. I just picked 11 counties, 11 mandate, 11 no mandate, but I made sure their populations were the same or really close to each other. So you can see there on my side, the average population in the mandate counties was about 10,400, and the average population in the no mandate was about 9,800. So my difference was only 565 people, or 6%. I was able to replicate their findings for no mandate counties, 100%, and I got 75%, but whereas they said mandate counties had a 6% decline, I found that mandate counties, when you hold the population the same, actually saw an increase in cases. Now, it doesn't mean that mandates are even counterproductive. What it does mean is that the CDC study did not do their homework, right? If I can correct for a certain bias and then have results that are the complete opposite, just like the scientific process kind of allows, testing theories, then it would tell the other side to go back and make sure they dotted their I's and crossed their T's. So what I decided to do for us today is I pulled up Leavenworth County and I pulled another county that has a very similar population, Riley County. And you can see there in the parentheses, the populations are pretty close to each other, 81.7 and 74.2. Can you tell me which county, if you weren't from Leavenworth, had a mandate in it and which county did not? I can't. Yes, I think 3 cities here have a mask mandate, right? But the county doesn't have any mandate, and compared to Riley County, which has one, I can't see any particular difference in terms of COVID cases. So the call to trust the science is not a call to adapt to new information, as you have most certainly guessed. In fact, it's a shield to never openly discuss why some officials are in favor of one outcome over another. It's about maintaining power. And so the cure is for government to be honest, humble, and of course, to serve the public. Let's talk about solutions. Checks and balances. I understand the sentiment that we all have. I don't like it, or let me preface it this way. I understand the sentiment because I come from Douglas County, from Lawrence, right? The most restrictive county in Kansas. I would love to take away that power so that they wouldn't exert power over me. But I know I can't do that. I know this is the same issue that our founding fathers had, right, in dealing with creating a whole new government. While it's easy just to create something that's the opposite of all that you've experienced, what's most important is creating a system of checks and balances. Because not only is it important to stop COVID today, but you want to be prepared and stop the next calamity. So when it comes to checks and balances, one thing I would recommend is that the emergency declaration for human viruses, so the next disease that may come down the pike, they can only be extended in 30-day increments. As it currently stands, and Representative Neely can most certainly correct me if I say this mistakenly, the governor can issue any emergency declaration if she wants. If this one expires, there's nothing stopping her the next day to issue another one over the same exact disease. She doesn't have that power when it comes to animal diseases, but she has free reign when it comes to human diseases, and the compromise House Bill 2016 is only a temporary measure. So we have to make sure we put into law that she cannot just continue to issue emergency declaration after emergency declaration over the same issue. Give it some space. Second, as you've probably been aware, the State Finance Council, in watching the governor, it's a council made up of legislative leaders with the governor at the head, isn't getting anything done, right? Not necessarily to the fault of legislators, but the fault is that the legislators can completely go in one direction. That the governor says no, nothing happens, right? And it's the governor's order that they're usually discussing. So what needs to happen is the oversight committee must no longer be that State Finance Council. It should be a council of purely a legislative body, right? That is where the power to make laws come from, and so that is who should have oversight over the governor's orders that would act as a law. And as a little sprinkle, if you can do this, make it more geographically balanced if we can. Let's get some people, on that committee from Northeast Kansas. Let's get some people out there from Western Kansas. That way we can make sure that proper, voices about different experiences are out there and heard. On the local side, county commissioners should have active oversight to approve, reject, or modify emergency orders. And it's not just the governor's emergency orders, but local as well. Far too many times, I don't know if this has happened in Leavenworth, but I know what's happened in my county of Douglas. A public health officer makes some decree, and the county commissioners just let it go on through. Don't vote on it. No. We can't vote out a public health officer. We vote out the county commissioners, right? So the county commissioners must approve that vote. If the public health officer makes a decree, the county commissioner, if they really want it to go through, must vote to approve it and take the consequences of such an action. And of course, if they feel like it's a good action, convince us that it is. Also, another thing, businesses that are ordered closed by an emergency order, either at the local or the state level, should be compensated for it.
Good idea.
We talk about trade-offs, right?
Yeah.
Except when it comes to these trade-offs, we're the ones dealing with the negative consequences of these trade-offs, and the government does not. So by forcing government to pay or to compensate these businesses for their orders, it ties them to that trade-off. If they don't like it, don't shut down businesses.
Right.
Due process. We must, of course, make sure it is clear that we extend due process and habeas corpus to those who are prohibited from seeing their family, working, attending church, school, any way, shape, or form. That's right. If you are told to quarantine, you have a right to have your voice heard in a court. Data transparency, cycle thresholds, we need more information on those, right? The sensitivities of those COVID tests. Vaccines, my goodness, how hard it was to get information about how we're doing in vaccines. It's like pulling teeth. It should be a lot clearer to get that information out to the public so that they can discern as to whether we're doing the right moves or not. Economic recovery. Governor Kelly did a great job at the onset of the pandemic. She loosened a lot of rules for doctors and healthcare providers to work more in the state. I love it. I like it so much, I want it in law. Okay? Tax relief. Makes complete sense. If we're dealing with a recession, give more resources back to the people, right? Help those businesses, help those families, make sure we're not taxing people out of their homes so that we can rebound from this recession as quickly as possible. And something that is related to all of these is we need smaller government. We need a limit on that size, right? Because if we don't, the governor's going to raise taxes during a recession. In the governor's proposal, she has in there a tax on streaming services, digital products. I can't think of a more horrible way to kick people when they're down than to tax the streaming services that we have all been reluctantly watching because we have been stuck at home. Right? Disney Plus, Netflix, Spotify, all taxed. Same thing about online sales. I can't tell you how many packages have come to my house because my wife has bought something on Etsy and Pinterest, and I don't even know what Pinterest really is, but it means goods come to my house in brown packages. But the Governor Kelly would love to tax that as well. She also wants to delay loan repayments. Whereas we can't get past our loans, the governor thinks that she can easily just push off on hers. She wants to re-amortize state pensions. So if you're a state worker, that's your retirement system. Re-amortization, if you don't know what that means, it's like refinancing a mortgage, but you're not getting a lower interest rate. Right? So you can get smaller scheduled payments, right, because you've reset your horizon, but as we all know, you'll pay more in debt before the whole thing is through, and for Kansas, it's about $4 billion in long-term debt. Now, in the governor's State of the State address, she said she was going to stop taking from the quote-unquote Bank of KDOT, the highway fund. But if you look at her budgets that she's proposed, she would have taken, by the time she finishes her first term, $600 million from the state highway fund.
Wow.
And then an Obamacare expansion is also part of the proposal. But now, there's a new wrinkle, isn't there? She wants to pay for it with marijuana. Medical marijuana, I'm sorry, I apologize. Medical marijuana, that's right. So now I have glaucoma. Yes, that's what I wanted to say. I think Pompeo made a joke about that. I don't want to tell the story, but he made a joke about medical marijuana and people just asking their doctors saying they have glaucoma now in order to get it. So what we decided to do was we created our own budget here at KPI. We said, is it possible that we can give Kansans back some of their resources, provide some tax relief? Can we shore up the budget, and can we cut spending but not eliminate services? And the answer was yes. We found $835 million in waste.
Wow.
It's just additional money. In fact, that $835 million is supplemented with other funds. So you could cut this waste out without having to get rid of any government services. We stopped robbing the Bank of KDOT in our proposal. We give $85 million in tax relief. Of course, no Obamacare expansion. And we've given enough of a cushion for the state budget that we will protect it against the next recession. So in summary, COVID may be a once-in-a-lifetime event, but too many government officials have used that event to coalesce more power at the expense of our freedom and livelihoods. They hide data, and then they use their authority as a cover to maintain that power. So the best tools that we have to fight COVID and government intervention is with a proper system of checks and balances and a limit on the size of government.
Great.
Any questions? Representative?
I just had three things. One, I want to make you happy because they are putting into law about the doctors and the nurses being able to come into the state of Kansas. The only thing that is being done on that is that they practice under Kansas law. They have to turn around and register with the state of Kansas. It doesn't mean that they can't practice here, it just means that they have to follow Kansas laws if they're different from the state that they came from, which we have to have that. I mean, the Kansas laws are Kansas laws, and if you're practicing here, you have to follow our laws. On another thing, the KDOT situation, we saw the secretary in charge of transportation the other day. They had 21 large things that they wanted to get done this year, and because of the money situation and the COVID situation, they have gotten 3. And she's anticipating, because of the amount of money that's going to be taken from KDOT, that they may not be able to do any more in anything of these large things that they're trying to get done. Now, whether or not that'll happen, they're going to continue to try, they're going to continue to work until they're told to stop. But they definitely are worried about that they're going to be able to do the 21 things that they anticipate. So, anyway, I just wanted to turn around and try and make you a little happier than anything about that.
Thank you, sir. Yes, ma'am.
Yeah, I'd like to ask your opinion on this vaccine. Are you for it, against it? What's your thoughts?
That's a great question. My wife is a healthcare provider, and and working in a hospital, you know, she had initial concerns about taking the vaccine. She wanted to pass that on for either, you know, the elderly or other nurses or doctors that may want to take it. But we recently did decide to take the vaccine because we were going to take certain endeavors in the future. And I know she was worried about COVID and you know, passing it to our mothers and our fathers and things like that. So we did decide to take the vaccine. I personally am not planning on taking it, you know, just yet, but that's where we are. I'm completely fine with the vaccine. If you want to take it, you're most certainly welcome to take it. I have an issue if it comes down to a mandate.
Thank you.
Mm-hmm.
Yeah, okay.
You sir, would you like to pass it on?
First, I'll take it next.
Okay, yes sir.
I wouldn't make a comment on the people that are skeptical of vaccines in general. They noted that during this last year when mothers didn't take their children in for vaccinations at the rate that they normally did, that SIDS was down considerably, sudden infant deaths, and also that normal flu is practically eliminated.
No.
Yeah, where's that? What happened to the flu?
It's in COVID numbers.
You know, did the mask stop the flu and not the COVID? Or is there some sort of, you know, viral interaction? I think there's new science on that that's looking into whether the flu has been affected by the COVID outbreak, where it's been affected by that, but that's a great question. I have no idea.
I thought the flu was included in the COVID numbers.
It is, but you can also look at the CDC, which breaks it out, and they don't see it either. And this isn't just a Kansas thing, this is nationwide. The flu has virtually disappeared.
Yeah.
But
Yeah.
I thought it disappeared because in reporting, the flu is now COVID.
They
don't distinguish.
They have
Yeah.
COVID-like illness, they have, you know, pneumonia-like illness, and then they also have influenza-like illness, as well as there's also research that looks into ILI, influenza-like illness, as well as CLI, and COVID is where it's at, you've heard the news, but the flu is at the lowest levels it has ever been seen, and there's just new research that's going into, you know, the why, and there's no one to pin it down as of yet. Sir in the green.
Well, mine is a question. My wife knows I love to do research. But we have mask mandates, and I want to go back to what you said, Leavenworth and Riley. Riley mandates, or Leavenworth mandate. But there was hardly any difference. When I checked with some doctors on the internet at some major institutes, they said that people that are wearing masks with the fancy chiefs or bills, whomever, cloth masks, bandanas, 3-ply masks, they're worthless. It can only be 4-ply medical surgical quality masks or N95s. Everything else they said is like trying to stop a fly from coming into your house, putting up a chain link fence.
Let me see if I can. The science on masks this year, and this year only, because it was pretty consistent before 2020, has been all over the place. And you're right, I don't need to tell you. At the onset, they said don't use a cloth mask. Then in the middle of lockdowns, they said use a cloth mask, but then they closed all the Hobby Lobby and Joann stores, so I don't know how I could get a cloth. Then they said, you know, masks only work a little bit. And then they said use N95, and now they're saying only use N95. And now, just recently, Dr. Fauci has said use double masks. When like 5 days ago, you could find an interview of him saying double masks don't work. So, you know, I wish that our officials had been a little bit more honest with us, right, about mask usage. I can easily understand how, if you're going to sneeze, as an example, putting something in front of your face will stop it from spreading. Makes sense, right? But, you know, when what's being told to us is that masks will be, you know, what will stop the spread, it will be the number one thing that we can do to get rid of COVID, that's clearly not true. So I would have loved a little courtesy, because that can go a long way. And it would make us all better as a society for it. Yes, sir.
Is there a way to get your budget in front of the legislators to compete with Governor Kelly's?
This is what I do. So I am planning on speaking to the House and Senate budget committees with my budget proposal. If you want, not only can I send you all these slides, thanks Melinda, but I can also send my budget proposals as well, so that you can all see it. This is all publicly available. Thank you. Any other questions? People?
So you talked about the giving the counties authority, which in this county, we've been privileged to have a good commission that has not implemented the mask mandate. However, we have a city commission that is using the home rule authority and has usurped the county commissioners and implemented a mask mandate within the city limits. So we talked about the methods that we're using here to combat that. But do you know of any other counties that are doing the same things?
Petitions?
No, not the petitions, but like the cities using their home rule authority, usurping their county authority.
Yes, I know that happened in Sedgwick County, Wichita, and the mayor there, oh gosh, can't remember his name. Whipple, thank you. Whipple had implemented a mask mandate for the city. That's to my knowledge. Yeah, I don't want to say anywhere else, but I know it's prevalent out there. There are a couple more cities and counties that are diverging in terms of that policy.
And we're in the process of actually working with another committee that are working with other counties to try to implement petitions all over the state of Kansas to deal with that actual issue. So just FYI.
Thank you. Any other questions? Yes, ma'am.
I'm wondering, have you done any studies on the whole idea of instituting at-home immunities to make a difference? I know that we talked about herd immunities at the beginning of this thing. It seems like, you know, we're building up our own immunities. That's just going on, nobody even mentioned, all we do is talk about masks. And yet, our own daughter was proof of that, because her husband's family, not her mother-in-law is a school teacher, her father-in-law works in construction, and the siblings were all in school. When they got it, no effect whatsoever. They had a sniffle for a day, and he's even with a video game for 2 weeks, because they all required to. Well, then when her husband got it, he builds, he's a construction worker, and he's currently building a sewage plant. A few germs there. Sniffles for a few hours, nothing. We have a 2-year-old son, as she jokes, eats dirt. sniffles for a couple of hours, nothing else. She was down for 2 weeks because she's been doing everything that the government told her she should. She's going to stores, she did all her shopping, she was picking up at Walmart delivery, she always wore a mask and nothing. And so when she got it, everybody else in the family, no effect, and she was out for 2 weeks. And she wasn't living with her in-laws, so they don't be all in the same house. But the fact is, she's the one that really got the effect. Now, she's fine, you know, but it was, the whole thing is, she is convinced it's because she didn't have the immunities, especially the 2-year-old had, let alone her husband has with his job, because she was a graphic designer while her work was at home anyway. And so she's just like, that's it, I'm gonna go to play dates, I'm gonna go shake everybody's hands, I'm done. And, but of course, that's already happened, so it doesn't matter. But I just wonder, is anybody even studying that?
Yeah, there's plenty of studies on herd immunity. There's so much study about it that. Personal, excuse me, I apologize. What we know with COVID and how it's run through Kansas is that if you were under the age of 65, the survival rate if you have COVID is over 98%, right? Now, it doesn't speak to your severity, right? But even then, I believe severity is maybe 3% out of the entire population. So if you have COVID, there's a 3% chance you might go to the hospital for it. If you're a child, if you're under 18, there have been no deaths. No child in Kansas has died from COVID. However, if you are over 65, that's when the mortality rates go up. And I think they're about 90% of a survival rate if you're over 65. But, you know, everyone has personal experiences, and what we find with COVID is that there are symptomatic cases and then there are asymptomatic. And there's also pre-symptomatic, right, which is before you even develop symptoms, but you have the virus. But obviously everyone's different. But now that we have understand that for by and large the population, all you have to do is make sure you protect the elderly. It all means that we didn't need to shut down our economy. We didn't need to close schools. We can open schools back up. Does Leavenworth open schools? Are you guys fully open? Or does some have hybrid? No? No, I'm sorry. Douglas County as well. We're hybrid. We're only 2 days. But there's no reason to keep schools closed. Research after research says there is no student to teacher transmission. When you open schools, it's usually from, you know, either, it's usually adult to adult. But we got to keep pushing. We got to get past that type of bias. Commissioner.
Have you studied or looked into the marvelous rollout of the vaccines in Kansas and how that's been done?
I have.
And can you share a little of the insight that you might have on that?
Yes. I guess maybe I should try to answer a potential question you have. Why is it so slow?
Yeah, that's one reason.
Okay. One reason why it's so slow is because Governor Kelly didn't prepare for it. That's one of the easiest answers I can give. Back during the time when we had all this hospital surge, and there was a lot of reports about hospitals not having the proper staff to take care of beds, you know, we could have been planning, right, for proper administration and communication for the rollout of the vaccine. But even Secretary Norman's admitted that at that time, it was not their priority. Okay. Second reason I think the rollout has been so poor is because we've made our prioritization way too complicated. So if you just look at the CDC vaccination plan, to sum it up for you, it wants everybody in a nursing home vaccinated. This is like what they call their phase 1. Everybody in a nursing home vaccinated. Then it wants you to vaccinate all healthcare workers, and then it wants you to vaccinate all the elderly in the general population. That's basically its phase 1. What does Kansas have? Kansas has, yes, nursing homes, yes, healthcare workers, but also this term called frontline workers, which are your grocers, your teachers, your police and fire, all these other individuals, which, as I just told you, if you're under the age of 65, you know, you're not going to die from COVID, right? And then it goes into the elderly population, and the elderly population is also mixed in with the congregate setting. So those are your prisoners, those are your independent nursing homes. And And those are all these young people, right, who, of course, need the virus, but that means that's one vaccine that's not getting into an elderly Kansan who, let's say, is stuck in a nursing home and can't see their family or friends. So if I could sum it up into two things, it would be poor preparation and then a little too complicated of a vaccine plan. West Virginia, as an example, in 2 weeks, vaccinated their entire nursing home population. Right now, I think there are 80% done of all the elderly in the general population. And we haven't finished vaccinating everybody in the nursing homes. And it's not a federal government issue either, because according to the CDC, around 60% of vaccines the state already has is still on the shelf.
You kind of opened the door with your economic discussion, budget discussion, so it's going to seem a little off, but we're in a transition period in this January with a new president who's already written a number of mandates with economic implications. Are you or KPI looking at what those are that then our legislatures can look toward nullifying? That's kind of where we're headed. Some of these mandates.
Not everyone, because I'm just one person. But we are looking at those, of course, that will have a big impact here. So obviously there's going to be another COVID relief bill in some way, shape, or form that will be passed. And we'll look to see what that means for the state, what that means for localities. What we think, of course, it means is, one thing is that it will cover Governor Kelly's budget. So the shortfall that she's creating, we have a pretty good idea that when Biden's bill comes through, it's going to allow Governor Kelly to backfill all of her revenue losses so that she can keep that high record level of spending. Another thing we're of course looking into is minimum wage. That seems to be something that could go through, and either it could go through or they could push it on to the states and try to encourage more states to raise the minimum wage. So we're preparing for that as well. Those are things I can think of off the top of my head. Thank you. Any other questions? Yes, sir.
Yes, one of the things that President Biden is going to do is just create an open border. And with that happening, what sort of a pandemic problem will that be for us with the people coming from Central America that have not been properly vetted?
The short answer is I do not know, but I have looked into, it was around the summer of 2020. Texas was getting a lot of pressure to implement more restrictions because, as you see, they were seeing a lot of COVID patients coming in around the Houston area. But when you look at that data, what it actually was people getting COVID in Mexico wanting to go into a good hospital. So they would cross the border, get into a hospital in Texas, and then of course that's where it was recorded. So I don't know what that would mean if under a more loose border policy, but I do know that of course many people love to come to America because it's a higher quality of living and better services. So I would see that happening to some extent, but I can't tell you to what scale. Any other questions? Tough crowd, great. Well, thank you very much. Thank you very much. You can find me, let me get back to the end here. Sorry, 1 second. You can find me on Facebook, Twitter, and whenever Parler comes back up, at KS Tax Economist. All right, thank you again.
Yeah.